One of the most common concerns surrounding vaccines is that vaccination can cause autism. Let's explore the facts and address these concerns. In this video, we'll review what autism is and what we know about its causes, how concerns about vaccines and autism started, and the quality and quantity of studies that show there is no link between vaccines and autism. We hope this video will help healthcare providers feel more confident in addressing parent and patient concerns about vaccines and autism. We'll start by defining autism and learning more about symptoms and causes. According to the National Institute of Mental Health, autism spectrum disorder, or ASD, is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Because it's a developmental disorder, symptoms generally appear within the first 2 years of life. This is important to remember as we debunk the relationship between vaccines and autism. However, autism can be diagnosed at any age. Autism is unique to each individual and looks different for everyone. This is why it's known as a spectrum disorder. An estimated 1 in 36 children and 1 in 45 adults in the U.S. are affected by autism. Individuals typically receive a diagnosis in childhood. Family members, doctors, and teachers may notice that a child has difficulty interacting and communicating with others, has restricted interests, and/or has repetitive behaviors. These are the common characteristics of ASD, and they may affect one's ability to function in school as a child or work and other areas of life as they grow older. So what causes autism? Research suggests that ASD is caused by a complex combination of genetic and environmental factors. Twin studies show that when one twin is diagnosed broadly within the autism spectrum, around 92% of the time, an identical twin will also be diagnosed. In fraternal twins, this rate falls to around 10%, demonstrating a clear genetic basis for ASD. When certain viral infections affect a fetus during pregnancy, they may also be linked to an increased risk of autism, particularly if they cause encephalitis. These infections include measles, congenital rubella, herpes simplex, mumps, varicella, and cytomegalovirus. Research also suggests that parental age may be a factor in the development of autism. As the age of parents increases, the risk of autism for their children also increases. Other factors that may increase the likelihood of autism development include medications taken during pregnancy, such as valproic acid and thalidomide, low birth weight, and other genetic conditions, such as Down syndrome. It's important to note that there is still much we don't know about ASD, and researchers are still learning about what causes it. Ongoing research is critical to uncovering more about the causes of autism and understanding the interplay between genetic and environmental factors. Now that we know what autism is, let's review how vaccines entered the picture. One of the most infamous sources that anti-vaccine groups commonly cite is known as the Wakefield study. In 1998, a British doctor named Andrew Wakefield published a study in the medical journal The Lancet claiming that the measles, mumps, and rubella, or MMR vaccine, caused autism. In his study, Wakefield hypothesized that following an MMR vaccine, autism was caused by intestinal inflammation, the entrance of harmful proteins in the bloodstream, and the arrival of these proteins in the brain. He reported that of the 12 children involved in the study, 8 developed autism within 1 month of receiving the MMR vaccine. The study concluded that the MMR vaccine must have been the cause of autism in these children. Despite the flaws and falsehoods in Wakefield's study, the idea that the MMR vaccine caused autism in children spread quickly, and many communities accepted this claim to be true. Wakefield's study was shown over time to be fraudulent and misleading. Let's examine the ethical concerns and study design flaws, and explore how Wakefield's hypothesis was thoroughly debunked and disproven. The study was not able to be replicated. Following Wakefield's claim, no other large-scale, high-quality studies were able to replicate his results, demonstrating a severe lack of evidence for the association between the MMR vaccine and autism. There were significant issues with study design. Further inspection of Wakefield's research methods revealed that he had conducted a case series study, which is a type of research used to examine several subjects with exposure to the same disease or intervention. Case series studies lack a control group, which means that they cannot be used to prove causality. Wakefield did not implement a control group in his study and did not compare vaccinated and unvaccinated children. Therefore, the study should not have been used to claim causality between MMR vaccines and autism. Other problems with his study design also existed. Wakefield's sample size for his study was only 12 participants, which is very small for a research study. This greatly limited the ability to generalize any conclusions from this study. In addition, his participants were all self-selected by the researchers based on referrals by anti-vaccine groups. These issues with the study sample, along with the fact that they were not disclosed by the researchers, created an enormous potential for bias within the study. The timelines in the study were altered to exaggerate results. Wakefield altered the timeline of events in his study to strengthen his hypothesis and further support his claim. Wakefield claimed that several children developed symptoms of autism just 2 weeks following an MMR vaccine. However, medical records showed that in many cases, these symptoms began months after the vaccine. Additionally, the authors argued that autism was a consequence following intestinal inflammation, but intestinal symptoms were observed after autism symptoms in all cases, not before. We'll discuss this later on in the video, but the coincidental timing of when the MMR vaccine is given and a typical autism diagnosis also weakens Wakefield's claims. Around 90% of children in England had received the MMR vaccine when this paper was written. The MMR vaccine is commonly given at a time when many children are diagnosed with autism. Therefore, it would be expected that most children with autism would have received an MMR vaccine, and many of them would have received it recently. This coincidence was not addressed in Wakefield's study. There were undisclosed conflicts of interest. Another issue outside of the research methods was that the authors of this study failed to disclose financial and other conflicts of interest. Wakefield had been funded by lawyers who were planning lawsuits against vaccine manufacturing companies. This financial incentive severely compromised the integrity of the study, as the authors were likely motivated to report certain findings. This is a clear violation of ethical guidelines in research, especially human subjects research. In another concerning turn of events, it was later discovered that Wakefield had submitted patent applications for his own measles vaccine and his own cure for autism 9 months prior to the study. Once again, this was not disclosed as a conflict of interest and raised serious questions about the integrity of the study. Many ethical guidelines were violated. Other ethical guidelines were also breached, such as procedures being conducted on the children without proper approval. The study also lacked proper approval from an institutional review board, which is a group that reviews proposals for research to ensure that participants' rights are protected during the study. The paper was retracted from the scientific journal. In light of these revelations, Wakefield's paper was retracted from the Lancet. This retraction was due to the scientific misrepresentation in the paper and the ethical violations the authors had committed. Soon after, Wakefield also lost his medical license. The panel who investigated the case stated that Wakefield had repeatedly breached the fundamental principles of research medicine in his measles vaccine study. As a result of Wakefield's revoked medical license, the study's retraction, and all of the reasons previously mentioned, it became abundantly clear that the study was fraudulent, misleading, and a serious form of scientific misconduct. Wakefield's study is regarded as one of the most impactful frauds in research and medical history. Despite the retraction of the paper and the abundance of evidence that came out opposing Wakefield's claim, the belief that the MMR vaccine causes autism persists. This belief has reduced vaccine acceptance, leading to increased measles cases, deaths, and widespread distrust in medical institutions and other vaccines. One example of the impact that Wakefield's false claim had is the decline in Great Britain's MMR vaccination rate. Following the publication of Wakefield's paper, the vaccination rate among 2-year-olds had fallen to 78.9% in 2003. This is far below the threshold for measles herd immunity, and subsequent outbreaks of measles occurred. Another example of the effect of Wakefield's false claim is the 2017 measles outbreak in Minnesota. Between 2004 and 2014, Andrew Wakefield met with Somali American community groups in Minnesota. He continued to perpetuate the claim that the MMR vaccine was dangerous and could cause autism in children, fueling fear and anti-vaccine sentiments. Prior to 2004, MMR vaccination rates in these Somali American communities were higher than other children in the state. However, by 2014, the rates had dropped from 92% to only 42%. This is far beneath the 92 to 94% threshold needed to achieve herd immunity and keep communities protected. In 2017, as a result of low MMR vaccination rates, Minnesota experienced its worst measles outbreak in over 30 years, primarily affecting the Somali American population in the state. 95% of the cases were unvaccinated, and nearly 1/3 of cases required hospitalization. This outbreak demonstrated not only the physical dangers of measles infection, but also the dangers of perpetuating this disproven claim about MMR vaccines. The decline in MMR vaccination rates among this community demonstrated another important concept. If the MMR vaccine did cause autism, then the rates of autism in the Somali American community, who had far lower vaccination rates compared to other racial and ethnic groups, would be lower. However, despite the decline in vaccine uptake, there has been no corresponding decrease in autism rates. Autism diagnoses have increased since the early 1990s, leading some to speculate that vaccines are to blame. However, several key factors help explain this rise. First, changes in diagnostic criteria and greater awareness have played a significant role. Pediatricians now screen more frequently, and families, schools, and physicians are more knowledgeable about autism. As a result, many cases that might have gone undiagnosed in the past are now being recognized, contributing to the increase in reported cases. That being said, these factors likely do not fully account for the rise. Scientists have yet to fully quantify and identify the other factors that might be contributing to the increase in autism diagnoses, but they have thoroughly studied the potential link to vaccines. Their conclusion is clear: vaccines do not cause autism. However, certain voices, like Wakefield, still rise above science and research. Another prominent individual who has continued to perpetuate the idea that vaccines can cause autism is Jenny McCarthy. Jenny McCarthy, an American actress and model, began to have concerns about the MMR vaccine when her son was diagnosed with autism following vaccination. She firmly claimed that the vaccine caused her son's autism, and continued to spread this idea through the advocacy group Generation Rescue, which is no longer operating. However, while this group was alive, several financial incentives existed that provided motivation for the group to continue pushing this message. Many members of the organization's medical advisory board had recommended alternative products for the treatment of autism, from which they earn profit. We know that Wakefield's MMR study was fraudulent, but many people and parents, like Jenny McCarthy, still believe that vaccines can cause autism. However, an abundance of high-quality evidence, such as systematic reviews, clinical trials, case control studies, and cohort studies, exists that demonstrate there is no association between vaccines and autism. For example, one study in Denmark involving over 500,000 children examined the association between the MMR vaccine and autism. Researchers found that the risk of autism was the same between vaccinated and unvaccinated groups of children. There was also no association between various timings of the MMR vaccine and autism. Additionally, a 2014 meta-analysis of 10 different studies explored whether there was an association between any early childhood vaccine and autism. After analyzing data from over 1.2 million children, researchers found that there was no association between any vaccine and autism. Another reason to question the connection between MMR and other vaccines and autism is the coincidental timing between the two. As mentioned at the beginning of the video, autism typically begins to present during the first 2 years of life. This is also when the first dose of the MMR vaccine is usually given. Therefore, it's rather likely that symptoms of autism will begin to present around the same time a child receives an MMR vaccine. The best way to determine whether MMR causes autism is by studying the incidence of autism in both vaccinated and unvaccinated children. In Wakefield's study, this was not done. However, studies that have compared autism rates between the two show no significant difference between vaccinated and unvaccinated children. Additionally, subtle symptoms of autism may also be present before children receive the MMR vaccine. Through what's now referred to as home movie studies, researchers examined videos of children taken by their parents on their first birthdays. With a high degree of accuracy, developmental specialists were able to distinguish between autistic and non-autistic children just by watching these clips. Other studies expanded these videos to include clips from early infancy, and researchers were able to predict which children would develop autism from as early as 2 to 3 months old. These studies show how symptoms of autism may be present earlier than most parents expect and may often appear before the receipt of an MMR vaccine, providing a strong argument against vaccines as the cause of autism. Some parents were also concerned that thimerosal, an ingredient that used to be in some vaccines, caused autism. Thimerosal is a preservative that contains ethyl mercury, and it was removed from childhood vaccines by 2001 out of an abundance of caution. The MMR vaccines do not and never did contain thimerosal, and for vaccines that did contain thimerosal, many epidemiological studies have confirmed that there is no association between thimerosal and autism. Another concern was that the amount of vaccines given to infants and children could overwhelm their bodies and lead to the development of autism. There are several reasons why this claim is extremely unlikely to be true. During the vaccine licensing process, vaccines are tested in conjunction with one another. This testing ensures that giving multiple vaccines at the same time is safe and effective. From these studies, we know that giving multiple vaccines at once does not overwhelm an infant or child's immune system. In addition to vaccine safety studies, we can also consider the immunological components in vaccines. The number of immunological components contained in childhood vaccines has decreased over time. 100 years ago, children would only receive the smallpox vaccine, which contained approximately 200 immunological components. Today, thanks to technological advances in vaccine development, the total number of immunological components in all childhood vaccines is less than 170. We also know that babies encounter a large number of bacteria and immunological challenges when they exit the womb. Babies are colonized by trillions of bacteria, each with thousands of immunological components. The impact that vaccines have on a baby's immune system is very, very small compared to what they encounter in their environment. Finally, babies' immune systems are prepared to face many threats, and their immune system has the capacity to create billions to hundreds of billions of different antibodies. Given this information, a baby's immune system would be able to respond to nearly 10,000 vaccines at once, which is far more than the 15 vaccines routinely recommended for them. Overall, epidemiological and biological research shows that the number of vaccines given to babies does not overwhelm their immune system and cannot cause autism. Delaying early vaccines also does not decrease the risk for developing autism. In fact, delaying vaccines leaves babies vulnerable to dangerous diseases for a longer period of time. We've now reviewed an abundance of high-quality evidence showing that vaccines do not cause autism. Why is it important to be able to discuss these concerns and explain what research says about vaccines and autism? One reason is that many parents are still unsure about whether or not vaccines cause autism. One study in June of 2024 found that 1 in 4 parents still believed that the MMR vaccine caused autism. Another study found that 29% of parents believed that the association between MMR vaccine and autism was either definitely or probably true. Despite the retraction of Wakefield's paper and the multitude of large-scale studies refuting this claim, there is still a significant number of parents who believe that the MMR or other vaccines cause autism. It's important to consistently combat this misinformation and have the ability to discuss these concerns with parents. The persistence of these false claims can be dangerous, as seen in the 2017 Minnesota measles outbreak, and delaying or withholding early childhood vaccines due to these fears leaves children unprotected against deadly diseases. Throughout this video, we defined autism and shared what is known about the causes of autism. We then discussed how Andrew Wakefield's study laid a foundation for the mistaken claim that vaccines can cause autism, and how voices like Jenny McCarthy continue to perpetuate this belief. We examined the reasons why Wakefield's study was shown to be fraudulent and eventually retracted from The Lancet. Finally, we presented a variety of high-quality epidemiological and biological evidence to show that there is no association between any vaccine and autism.